close friends, family, I keep informed about what's going on, so that they can understand what my commitments are, what I'm doing with my day and what I'm doing with my week and with my time. I guess I get back from them a lot of support, encouragement, understanding, care and love. I don't tell everyone. It's not always relevant. Sometimes where I have told someone, I don't want it to dominate the conversation, and that can quickly happen because it becomes a conversation. There are questions and answers, so I do pick and choose about who I tell. But I think with close friends and family, it's really important that they know what's going on, and from them I get a lot of strength back as well.
We would like to tailor the specific resources to the individual who we're looking after. And we can also, regarding communicating with their families and with their communities, we can teach people, give them some skills about how to start talking about this new event in their life in language that makes sense to them and that's non-threatening to their families and to the communities. And also important, I think, to remind people they're communicating with their families and who they live with, but they don't have to communicate all the time purely about their cancer and their cancer treatment. It's okay to talk about other things in life as well.
I think it's strengthened a lot of my relationships, especially my relationship with my family and my siblings. I think, with a prognosis and a diagnosis that's so life-threatening, it definitely brought the family closer, and that closeness hasn't changed. The same with my friends. I did lose a few friends. They weren't able to, deal with the severity of what I was going through, and I think at the time it was quite difficult to deal with, but at the same time, those friends that wouldn't stick there around those difficult times, they're not worth having in your life, really. So for me, I didn't see it as a loss. I almost saw it as a gain because I got to see who my true friends were and the true supportive people were in my life.
Well, I'm not sure there's any rules, but I'd always be guided by Peter's needs in that. So I think he dictates what sorts of supports he needs. But I guess the other question is what supports have I needed in it? And most of our friends are mutual friends, and we both told all our family members at very early stages what was happening, so they're aware of it.
One of the things that we did was we would often socialise and get together. When Dad was in the hospital, we would all gather there, and so they'd be watching the footy or things like that gave us a sense of being just a normal family, and although we weren't at home, we were in the hospital. That was a good thing to do.
In my point of view, that love is all about giving, and at that time I really needed my friends and my family to give their love to me. There wasn't a lot of me left to be able to give back, and I think in that point I had to realise that it was okay. It was very humbling to, realise that I could ask for help.
So supportive care is available to patients with cancer having immunotherapies, and supportive care is a very important component of cancer treatment. We put it in the immunotherapies on one path. Parallel to that is supportive care, and supportive care covers all aspects of the human being. In other words, their physical exercise, their diet, making sure they're thinking clearly, that they're not worried and anxious, that if they're harping on about something in their own mind, that they've got somebody they can share that with. And in addition to supportive care, there's supportive care personnel in people's communities where they lived, in the hospitals where they're receiving their immunotherapy. And there's also a specific group of supportive care teams that we work with, which we call the palliative care teams. And that supportive care helps people manage the symptoms of their cancer and the symptoms of their toxicities from their immunotherapy.
Initially when I had treatment, pain was an issue. at the palliative care section there, they kept me in hospital for a couple of days while they were able to determine what medication that I needed, and they were able to increase the dose of certain medications, and it took only probably about 2 or 3 days for them to control my pain, and I have not had an issue since with that. So the palliative care people certainly were very, very good.
We work in teams with many people that can step in from a supportive care point of view when needed, and then step into the background when they're not needed, so that we're not cluttering people's lives unnecessarily.
Yeah, I've been quite surprised at the amount of services that are available, and I'm talking about where we are out there. That the amount of people who've come to see us from this district nursing setup, Allied Health as it's called. So it's good, they come in to check how you go with your medication or whatever like that. So I've been quite surprised at that, the amount of services.
I definitely was seeing a psychologist. I thought that was probably one of the most important things at that time. It really helped me deal with not just the uncertainty, but she also did give me a lot of strategies to go home with.
People that are more engaged in their treatment generally feel more in control. And when you're diagnosed with cancer, everything can happen very quickly, and it can feel like if you're very much out of control. So being really engaged with your care does give you back some of that control. So being engaged in your care is things like, well, what are the questions that you have? So the questions that you'll have will be different to questions that other people will have. So what are the things that are important to you, and what do you want to understand about your treatment? How is it going to impact your lifestyle? How is it going to impact your life? And really understanding those things and processing that information so you know how it's going to affect you can give you back some of that control.
Know what's happening, to get support, talk to your oncologist, understand the process. If there are things that are concerning or worrying you, ask questions. Everybody is only too happy to treat you as an individual. We are all individuals and respond to your particular concerns.